For coming. My name is Brandon Lofton. I represent House District 104 in Mecklenburg County. Today we're here to talk about House Bill 1159, Investing in Teen Mental Health. I'm joined by Representative Donnie Lambeth, Representative Donna White, Representative Sarah Crawford, as well as Alicia Freeman from the UNC Chapel Hill School of Social Work. I'm especially grateful to be joined by Bo and Danielle South, who drove from Charlotte today so they could share their perspectives as parents on the need to invest in teen mental health. My wife Kelly and I have a 19-year-old son and a 17-year-old son. Our older son is more or less an open book. With our younger son, however, it takes a fair amount of effort to get anything more than good and fine in response to our questions about his life. We know that he, like his peers, is facing a lot of pressure and challenges. So like many parents of teenagers, we worry about how he is processing those challenges and carrying that pressure. The fact is our children are holding so much and may not feel comfortable opening up. They may not even know how to do so. This bill seeks to help address that problem by helping our students receive training, not just students, but teachers and staff, about how to identify and respond to signs of mental health challenges. It appropriates $1.3 million to expand youth mental health first aid and teen mental health first aid programs. This expansion would bring this training to 75 additional high schools in North Carolina, reaching over 15,000 more students. These programs are evidence-based courses that train teachers, staff, and students in grades 9 through 12 how to identify and respond to signs of mental health challenges. Studies have shown that teens who receive this training through these programs are 50% more likely to seek help about their mental health. Today we'll hear from Alicia Freeman, who's a program director for Youth Mental Health First Aid and Teen Mental Health First Aid, about how these programs work. We'll also hear from primary sponsors about why they support this bill, but first we will hear from Bo and Danielle South to talk about their experience as parents.
So on behalf of the South family, we're really thankful to be able to be here today. It's under extremely unfortunate circumstances, unfortunately for our family. Danielle and I lost our son, Parker South, last November to suicide. And before we get into our story and talk a little bit about Parker, I want to thank the representatives for sponsoring this bill. It's a no-brainer. It's the awareness and mental health is not there for kids this age, and so we're super thankful for what everyone's doing here.
Yeah, so we just wanted to talk a little bit about Parker and who he was. He was born on December 8th, 2007. He was our firstborn child. He was the firstborn child, grandchild in the family. He was obviously biased, but he was extremely handsome. He was very outgoing. He had a vibrant personality. He was a hardworking student. He was an excellent athlete. He excelled at golf, baseball, and probably his biggest love, although it wasn't his best sport, was basketball. He was a friend to everybody. We've heard countless stories since Parker passed about the reaching out that he did to kids that maybe were on the fringe or, not in the mix as much as some of the other kids. And he just was one of those kids that lifted everybody up. He was a varsity baseball player. He was a supportive teammate. No one cheered louder or harder than anybody other than Parker South on the baseball field. He was a super fan of his high school sports teams. A lot of his friends were athletes. He showed up for them for almost every single game. He was actively involved in Young Life. He had a new but growing faith. And ultimately, probably the last person that you would have ever thought would be in crisis. And we truly believe that because of the lack of conversation and education and because of the stigma surrounding mental health, that Parker did not know that what was happening to him was a health issue and that it was temporary and that it could be fixed. And so we just hope that our coming here today and sharing this story can help get the message out to more high school students so that they can understand what it means to be in a mental health crisis, so that their peers can understand, that their teachers and school administrators can understand, and so that we don't have to suffer any more unnecessary loss.
Well said.
I just want to take a quick moment as a parent just to thank you guys for, one, for driving all the way down here, but also for opening up and sharing about Parker. I can tell you as a father at Myers Park, Parker was a huge part of the community. The whole community definitely feels his loss. And I appreciate, as a father, you guys opening up about that and your advice to us parents to push in more with our children, and the need to build that supportive peer group and community with them. So I appreciate you guys taking the time to be here and share that. We will hear from Alicia Freeman from the UNC Chapel Hill School of Social Work to talk more about what these programs do and how they can help, and then we'll hear from our primary sponsors.
So first, I just want to honor the resilience and the strength of Bo and Danielle for sharing that. Teen mental health first aid really is a lifeline. It teaches peers in these situations how to recognize those warning signs and how to connect with a trusted adult and someone who's trained in youth mental health first aid that can connect them to those resources. We really want to increase hope in our youth and let them know that things can change. But through this evidence-based program, Teen Mental Health First Aid, we have been able to train over 7,000 youth across North Carolina, and we've also held annual teen mental health ambassador retreats. And we've seen students change. We've seen them develop an interest in becoming part of the mental health workforce. We've seen them go from high school to college and be student leaders in mental health as well. And we really noticed that about 50% of mental illness shows up by the age of 14. So our youth are struggling, and they shouldn't have to suffer in silence. And the more awareness we can bring to this topic, the more we can reduce the stigma that is ultimately a barrier for our youth getting the help that they deserve.
Thank you very much, Alicia. And now we'll hear from Representative Donnie Lambeth, then Representative White, and then Representative Crawford.
Thank you, and we do appreciate y'all being here. And unfortunately, as I travel around the state, it's all too often that I hear from parents with very similar stories. And that's actually why I'm on this bill as a primary sponsor, because there is such a need across our state to give parents and students across our state some hope that the state is looking for ways to and options of services to help them and their son or daughter receive much needed services. Now, quite frankly, this room should be overflowing with people that's interested in this topic, because this is a major issue across our state, and it's an issue that we must resolve and do better than we've been doing in the past. I would tell you that in our last budget cycle, the Department of Health and Human Services presented us with a major reform of our state's mental health services that totaled $835 million that we invested, and we're in the various stages of trying to implement that plan. But you can look at any survey or any statistics, and none of them's very good. Just a couple I'll share with you. 25% of the teens report depression and anxiety. Suicide is the leading cause of death among youth 10 to 14. That ought to scare us to death. 40% of the high school students report periods of sadness and hopelessness. 40%. So I believe this bill is a good step. It's one of just a variety of steps that we need to take to continue to address the challenges we have with our adolescents. I think that we can do better, and we must do better if we're going to respond to some of the crises that we see across our state with parents just like this that are suffering heartache and heart loss, that we can simply just do better. So thank you for being here.
Thank you all so much for being here today, and thank you so much for being here, Ms. Freeman. We appreciate your courage and your love for your son, and hopefully this is going to open doors for so many more people not have to face this. As a nurse, I've seen firsthand what happens when young people struggle in silence without the support they need. Too many teens across North Carolina are facing anxiety, depression, substance abuse, and even thoughts of suicide or acting out in suicide. And this bill takes a proactive approach by expanding evidence-based mental health, first aid training in our schools and communities. By helping students and adults recognize warning signs early and connect young people to trusted support, we can intervene sooner, reduce stigma, and potentially save lives. I've been so honored to be able to, I was one of the first actually when I was on the school board before I came to the legislature, I was appointed as the only school board member in the state on the Safer Schools Task Force. And that task force has been in place now for about 12 years, and it has done phenomenal things. And it started from the situations at Columbine, and all those safer schools is not what we're talking about right now. It really is, because that's where students spend so much of their time. And when students have and we learn through that process of the Safer Schools program that students connect with students, not necessarily adults, especially when they're teenagers. So I was so impressed, and the reason that I agreed to support 1159 is that this is a training program for students to be there for themselves and for each other, and that's something that I don't think we've actually had in a formal format before. So I think this is a fantastic idea. I appreciate Representative Lofton having it and bringing us all on board. And this is a great team behind me, not only at the local family and heart level, but as legislators who can hopefully make things happen. So I appreciate everyone being here today, and thank you so much for letting me be a part.
Good afternoon. I'm Sarah Crawford. I represent House District 66 in Wake County. And first, let me say thank you to the family for being here today, for sharing your story, for sharing about Parker, and for being willing to be open about the hardest thing that you could ever experience as parents. Thank you for being here. Thank you for your work, the important work that you do, and for being here to support this legislation. As the mother of two teenage daughters who I get to experience wide swaths of emotions, and similar to my colleague Representative Lofton, one who's very open and one who answers in short phrases, yes, no, fine, and that's about it. I deeply recognize the need for these types of support services for our young people. As you heard from my colleagues already, this is an incredible challenge facing our teens, and the numbers that we are faced with are numbers that should be so scary to us, and we should all be working so hard to ensure that we are using every single tool in our toolbox to address the mental health needs and the mental health priorities of our young people, especially our teens, who are faced with pressures so enormous that we can only begin to fathom. And so I am proud to be a sponsor of this bill. I am so proud that Representative Lofton asked me to join this bill, and proud to work with my colleagues, Representative Lambeth and Representative White, on this issue and so many other issues. Because as I said, we have a lot of tools in our toolbox, and this is just one that we should definitely be investing in to ensure that teens have peer-to-peer support, that teens can help themselves, and that they can help others. I am also led by the verse in Isaiah 6:8. Then I heard the voice of the Lord saying, "Whom shall I send, and who will go for us?" And I said, "Here am I, send me." That verse hangs on my wall as I go out the front door every single day. And I think we have a tremendous responsibility as legislators that when we do have the ability to make critical investments like this, that we show up and we say, "Here am I, send me to address these important issues." Thank you so much.